Now, it may be that those image findings that they pointed out are the cause of your pain. However, it might not be. All right, this video is for the people who have been told that they have some orthopedic sports medicine degenerative condition that's causing their chronic pain, and that was predominantly made based off of imaging. So imaging can be a very, very helpful tool at helping us, physicians, providers, things like that, to understand what is going on inside the body structurally, okay? Super important. Without that, we can't see inside the body, right? If you have surgery, you can see inside the body, but without surgically opening you up, we can't see what's going on inside structurally. Sometimes that is extremely, extremely important. As an example, if somebody has a ganglion cyst or something like that that is causing nerve compression, probably can't know that unless the ganglion cyst is large enough and you can palpate it. But if it's deeper and it's smaller, we can't see that unless we actually get some form of imaging. If you have knee pain and there's an osteochondral defect, so basically there's a defect in the cartilage and the bone, and that could be contributing to your pain, we're not going to know that unless we have some form of imaging. So imaging can be really, really helpful at us seeing what is going on structurally inside the body. But what we have to remember is that those structural changes may or may not be causing you pain. I'm going to say that again. The structural changes that are found on imaging, an MRI, a CT, an X-ray, an ultrasound, those may or may not be causing you pain. You can have structural changes on those imaging studies and you could have zero pain. I, myself, have structural changes. I got some in my elbow you can see on ultrasound. I've got stuff in my back. I've got stuff in my shoulders. I got no pain there, okay? You can have those changes and not have pain. But you can also have pain and have those changes. So that's where I want to go with this discussion is what happens when, let's say you have back pain and you get an MRI and it shows that you have a degenerative disc disease. Or you have knee pain and you get an MRI and it shows that you have a tear in your meniscus. We have to be careful not to take that information and link those two things together as absolute unless we have additional information to suggest that those are linked. So as an example, we'll go with the meniscus. If a patient comes in and let's say they have pain on the outside of their knee, and physical exam testing doesn't really show that the meniscus is a problem. So we're not getting any of our orthopedic tests that are saying meniscus is an issue. And the patient also does not report any mechanical symptoms in the knee, meaning the knee catches, it locks, has clicking, anything like that. And then we get an MRI and it shows that there's a tear in the medial meniscus, so on the inside of the knee joint. Well, that's probably not contributing to the pain on the outside of their knee joint, but they have that meniscus tear, and that becomes important in our discussion with the patient on patient education because degenerative and damaged tissues are more likely to further degenerate or have damage and things like that because the integrity of the tissue is not there. And obviously, the integrity is not there because it's a weak link in some form of myofascial chain or movement pattern or whatever it is. And so those things are important to discuss, but it's probably not causing or contributing to their lateral knee pain. Another example is in the low back. If we have a patient come in and they have some changes that suggest a tear in the disc, right? So MRI shows an annular tear, but this patient has no pain with any provocative movements for the disc. They do not have pain when they bend down forward, which will stress that posterior aspect of the disc or that tear. And they have pain when they go into extension or they stand really, really upright or lay on their stomach. Their pain is only on one side, whereas the tear in the disc is, let's say, midline. In those situations, we go, okay, you have this change, and that change is really important to us to discuss, but if your physical exam supports the diagnosis of facet syndrome or facet osteoarthritis, where the facet joints are actually contributing to pain, then it's not so much that that image finding of the tear in the disc is problematic, and it might be something else. Now, again, it's important to take that information in the larger context of everything, but we also have to make sure that we are not just immediately linking that structural change to what might be causing patients pain. So, if you are not sure if this has happened to you, these are the questions that you want to think about. If you went in and you saw a doctor for some pain, and that doctor then did some imaging on you, so they did an MRI and X-ray, didn't really place their hands on you a whole lot, and then you had this imaging, you went back and met with them, and they still did not really place their hands on you. They did not try to elicit your pain with physical maneuvers. There's no physical assessment, no orthopedic testing. And they said, this is what's causing your pain. And they pointed to something on imaging or told you something from imaging, yet they didn't really place their hands on you. If that's the case, then you might want to step back to just consider that what I'm talking about here is a possibility for you. Now, it may be that those image findings that they pointed out are the cause of your pain. However, it might not be. And so you might want to further explore physical exam, physical assessment to try and see if those things are linked. Something to think about if you are still suffering in chronic pain and you really haven't had a good orthopedic physical assessment, but you've had imaging and somebody's told you that's why you have pain. See you later.